Good evening, everybody. Welcome this evening to our APNA briefing. Just clicking over to 7 o'clock Eastern Daylight Savings Time, and great to have everybody here with us tonight as we kick off the Nurse Awards 2023, APNA Nurse Awards 2023. And it's great to be able to have everyone here who is eager and willing to either nominate themselves or to nominate someone else for an APNA Nurse Award. And we've got a bit of a presentation for you this evening to give you some information around how to nominate and the different new categories that we've got this year as well. So I'll just kick us off with an acknowledgement to country. So APNA acknowledges the traditional custodians on the land on which we meet, and we pay respect to the elders past and present. Well, good evening. My name is Mitch. I am a General Manager here at APNA, and joining me also this evening is Anmol, who is one of our communications officers. And Anmol's been doing a lot of work pulling together the Nurse Awards for this year, which is a little bit different, which is a bit exciting, to tell you the truth. So a bit of an agenda for us this evening. So we'll do a little bit of a how to use the Zoom platform. Then we'll jump straight into our spotlight topic, which is nominating for the APNA Nurse Awards 2023. We'll take some questions and then we'll jump into an APNA membership overview, which is very handy for any new members who would like to sort of be across all of the different membership benefits you get as part of APNA, or any people who are wanting to become a member, or also our members that have been members for a while, and just sort of a good little refresh to remind yourself of the different benefits you get as being part of being an APNA member. Then we'll take some questions at the end and then we'll wrap it up this evening. So just to start with, if you have any questions, please pop them in the Q&A section this evening, and you can upvote other people's questions as well. So let's just jump straight in. So nominating for the APNA Awards 2023. Well, we've been running awards here at APNA for quite a few years now. We had a bit of a hiatus over COVID due to a range of challenges, but we're back here doing Nurse Awards, and we've relaunched it this year. Historically, we have only really given away Nurse of the Year Award and Graduate Nurse of the Year Award, but this year we've pulled it out into 5 different categories, which we'll go through in a second, and it's really exciting. So APNA Nurse Awards recognises and celebrates nurses' outstanding service and contribution to primary healthcare nursing. This year, we have 3 categories open and 5 different awards, which is really exciting. And our nominations are open today. And we welcome all eligible nurses to jump in and apply. Nominations will close on the 26th of November. So you've got just over a month. And then we'll announce the winners in the Connect newsletter on the 4th of December at 5:30 p.m. So we have 3 categories open and 5 distinct awards, as I've just sort of said. We've got awards for experienced nurses to primary healthcare, graduate nurses, and also student nurses. So we've got something for everyone. So we actually are going to award 3 Nurse of the Year awards this year, and I'll explain a little bit more about that in a second. We're also going to award 1 Graduate Nurse of the Year, which is any nurse who's recently graduated, so within the last 3 years. And new this year, we're also going to do a Student Nurse of the Year award as well. So I said we were going to do 3 Nurse of the Year awards, and that's because APNA has recently relaunched our values. So positive disruptor, better together, and pursue excellence. And we're going to give away a Nurse of the Year award for each one of these categories. So you only need to enter once, and we will allocate 3 awards aligned with these different categories. And these are our different our different values here. So positive disruptor, we're community-minded, champions of change. Innately curious and open to innovation and ideas for the future. So if your submission, if you're the best submission that fits into the positive disruptor category, you'd win the Nurse of the Year positive disruptor. Also, if you fit into the Better Together category, which we'll assign once we see the nominations come in, and you are passionate and collaborative, fostering an environment where diversity is valued and voices are heard. or lastly, in the pursue excellence. So being evidence-based in the approach and hold our stakeholders and each others accountable as we strive for the highest standards of excellence. So those three Nurse of the Year awards, one will be Positive Disruptor, one will be Better Together, and the last one will be Pursue Excellence. So across the three different categories here, there are sort of those 5 different awards. So anyone can nominate for the APNA Awards. So anyone can nominate you. So this could be your manager, an institution, if you've got a workplace that wants to nominate you, a co-worker, a patient, a practice supervisor, or a friend. So anyone can nominate you, and also self-nominations will also be accepted as well. In terms of the eligibility criteria, nominees must have consent to be nominated. So you need to know that you're being nominated for the award. Be a registered nurse, enrolled nurse, midwife, or nurse practitioner currently registered with APRA. Obviously, that doesn't apply to the student nurse category. Be a current member of APNA, and board members are ineligible for these awards, and be working as a nurse in primary healthcare setting for a minimum of 4 years for either of for the 3 Nurse of the Year awards, or if you're a recently graduated nurse, have entered primary healthcare nursing and had a maximum of 3 years since the registration for the Graduate of the Year. And then for the nursing student, you have to be enrolled in a university of TAFE or other training organisation. Also, lastly, you need to be able to be willing to share your story with the APNA community. I'm going to hand over to Anmol here, who is going to give us a bit of an overview, but we're doing things a little bit differently this year. It's no written submissions like we have in the past. Anmol, tell us how do people nominate themselves or nominate someone else?
Thank you, Mitch. Good evening, everyone, and thank you for joining us tonight. We are excited to announce that this year we are accepting video submissions for the award nominations. Your video should be a short pitch of no more than 3 minutes, explaining why you or the person you are nominating deserves to win in any of the categories. To make sure the process is simple, we are accepting nominations through WhatsApp, or you can even use WhatsApp Web for your convenience. In case you do not use WhatsApp, you can email us your nominations. Here are some important tips for your nomination video. Ensure good lighting and clear audio in your video. Film your video in landscape mode for better quality. Keep your video under 3 minutes. And most importantly, provide clear details about your contributions and why you believe you should win the award or the person you are nominating. Now let's start with the process. The first step is to save APNA's number as your contact, which is 0417 366 831, or you can simply scan this barcode, which will directly lead you to our WhatsApp business account. Once that is done, you can open your WhatsApp on your phone, or you can even use WhatsApp Web, which will be easy for those who would be recording on their laptops or whose video size is too heavy to be sent by phone. Now, to open WhatsApp Web, you can simply Google it and you will have the link and instructions on the WhatsApp web page. Then you can just simply go to your chat list and look for APNA, which should appear once you have saved our number as contact. And if it doesn't, just close the app and open it again. Now simply choose the contact to send your nomination video. Tap on the attachment icon to attach your video submission. Now here, at this step, if you're making a submission through the phone, you could record a new video or select the one you have previously recorded, and then just press send and it's done. Now, once you have submitted the video, you can send us your details along with it as a text message and include your full name, your email address, your APNA number, the category for which you are submitting your entry, and obviously, as already mentioned, we do not require APNA number for students. Now, for those nominating someone else, we'll need you to send their full name, email, APNA number, their APRA number, and category for which they are being nominated. Also, please make sure you send your name, email, and APNA number, which is not mandatory and is only for those who are member with APNA. And it's done. It's that simple. If you have any questions, please email us or give us a direct call. And finally, good luck with your nominations.
Good luck indeed. We've tried to make it as simple as possible this year, but also made it a bit more engaging. You know, nobody really wants to sit down and write a couple hundred words, or you know, to nominate someone else to win an award. So we've tried to make it as easy as possible this year by allowing video nominations, which we think is a great step, and make it nice and easy as well. And those video nominations will most likely be using the videos to help promote the awards and to really sort of show off the great work that primary healthcare nurses across the country have been doing, and really sort of showcase that fantastic work. So a big step in the right direction from my perspective around the video nominations, and be great to have so many people coming through and showing us that enthusiasm, I suppose, during the video nomination, so we can see it. We don't have to read it on a piece of paper and try and analyze what you're trying to say. We can see the passion that you've got in your voice, and see how enthusiastic you are to nominate yourself, or to nominate someone else. So really excited to be able to do that. And, you know, using WhatsApp, it will be a nice, quick and easy process for anyone to be able to put a nomination in, which is really exciting. So we might, if anyone's got any questions, please do pop them into the Q&A or into the chat, and we'll be more than happy to answer those tonight. If you do have questions sort of once we've finished, you can send us an email. You can send Anmol a direct email as well. His email address is up there on the slide, or give us a call, you know, to have a bit of a chat around the different processes for nominations, and reach out if you have any questions. So we've got no questions at this stage. It means Anmol and I have done a good job explaining it, hopefully. So we might move on to the next part of our agenda this evening, which is giving a bit of a membership overview. Feel free to keep putting some questions into the chat there if you would like us to answer any of those questions, any of your questions, and, you know, we can come back and answer them at the end. So APNA membership, if you're a new APNA member, welcome. Thank you for joining the association. If you have been a member for years and years and years, thank you for still being a member of the association. And if you're yet to become a member, hopefully this will give you a bit of an overview on what APNA membership is. So with APNA membership, we equip nurses to succeed in their roles by giving them access to sort of 4 main buckets, as we call them: up-to-date education and resources, the latest industry news and guidelines, communities, expert advice and support, and access to insurance, advocacy, and different perks. So I'll go through each one of those just in a little bit of detail. So up-to-date education and resources. So nurses are kept up to date with CPD requirements and have the best practice education at their fingertips. So we have a fantastic library of online learning, which we keep up to date, which is relevant to all different types of primary healthcare. So there's content in there specifically for aged care nurses, for school nurses, for corrections nurses, for general practice nurses. You get the idea. And there's content that we keep updating and we keep adding to, and we keep adding different modules to that all the time. So there's always new CPD and education for you to do. We've got our Nursing Australia podcast, which is the most popular nursing podcast in the country. Also very big in South Korea. Don't ask me why, but the South Korean nurses seem to love our podcast as well, which is fantastic. And it is CPD on the run, so you can do some learning. You can listen to different bits and pieces. You can learn new things, and as long as you do a reflection in your CPD log, you can claim that as CPD as well. We run a range of educational events throughout the year, including our Festival of Nursing, which next year is in July, end of July in Adelaide. So that's one of those. And as a member, you get some pretty hefty discounts to the festival, but also the other events and workshops that we run. We also run a series called Nurse Know-How videos, which is sort of nurses giving some tips and tricks via video format, which is really handy as well. Then into the latest industry news and guidelines. We know that nurses in primary healthcare have such a wide scope and need to keep across a whole range of different things that are happening in the industry and in the sector. So the Connect tries to distill all of that information that you need to know every single week into one email and one newsletter, so you can have it easily digested. So that comes out every Monday evening. So you get the member version of that to get all the details. There's also our Primary Times magazine, which comes out once every 6 months into your letterbox. We also do some primary healthcare news and alerts if needed. And then there's also our online knowledge hub on the website. Thirdly, there's a community's expert advice and support where you can connect with a nursing expert for some one-on-one support, and then also connect with some nursing peers to facilitate knowledge sharing. So our nurse support line is staffed by expert nurses and is open business hours, and you can give them a call or drop them an email, and they can help with a wide range of different clinical and non-clinical topics. We also run some nurse talk event and different networking events also throughout the year, and we also have our online communities online for you to have a bit of a look at and communicate with other nurses through. Lastly, we've got our insurance advocacy and perks. So the CPD portal allows you to log your CPD. We have a professional indemnity insurance, which is an add-on to the membership and allows you to be covered with a policy in your own name. We have our career and education framework and tools, which allows you to map your career and education. We have Nurse Awards, which is what obviously we're launching here tonight, which is exciting. So, be recognized in the industry. There's also our advocacy team and various campaigns that they run throughout the year. Also some rewards and discounts as well. And then if you want to get involved, we've got our nurse advisory panel, which will let you represent your profession publicly. And also if you want to evaluate some nurse education. And then we've also got our negotiation guide there as well. So I suppose that brings us to the end this evening, and there's been no other sort of there's been no questions in the chat, so we might wrap it up there this evening. And thanks everyone for joining us. Good luck if you are going to nominate yourself or nominate someone else. We really do appreciate that and hope that you go through the process quite easily. If you have any questions or concerns, please reach out to the membership and engagement team, and they can steer you in the right direction. And we really want to hear all those amazing things that nurses out there around the country are doing. So looking forward to hearing and seeing your video submissions come in via WhatsApp, and we look forward to see the flood of those coming in over the next month. So fantastic to be here this evening, and thank you so much for joining us. And we'll wrap it up there. And thanks to Anmol for all his work on pulling all this together and providing the Nurse Awards 2023. But thanks everyone for joining us, and have a lovely evening.